Hi everyone, this is Sandra Cotterell, the CEO of the Codman Square Health Center, and we are so proud to support SCI by honoring Chetna Naimi, our partnership director, as the 2020 Community Social Capitalist. Over the past 5 years, Chetna has done an amazing job embracing both the concepts of healthcare and education at the only health center that has a high school on its campus in the country. She's done this by championing programs such as internship programs for the students, which has provided them the ability to get exposed to health careers. She's provided health services through coordinating with the dental program, where the students were able to receive dental screenings, as well as vision screenings, and even free glasses for those that have needed it. She's offered health fairs and information to student families so that they understand how to navigate the health system. She has also raised money for the Farm to School program for the students, and she's done it all with such grace and such charm. So Chetna, I just want to say we at Codman love you. We appreciate all that you've done for the partnership, and we just want to congratulate you for being named the 2020 Community Social Capitalist. Congratulations.
Where the two more of the biggest needs for us was making people feel safe at home with the information. So the first thing we did was like really not just rely on people reaching out to websites like CDC or other websites. That we wanted them to reach out to get this information from us. Even, and we told them that this information is totally, we are getting it through CDC or other reliable sources. So we did a lot of social media campaign in terms of saying what works, what is COVID-19, some of the very basic facts, because there was so much unknown and so much fear, but there was still information to share. So that's the first step we did, was to work with the school and health center, is to get the information out in smaller segments. Second was that we really used our school technology to reach out to parents one-on-one about how to keep your house safe, how to be safe, how to stay indoors, why it's so important to stay indoors, and then the food support. So as you know, the Boston Resiliency Fund is really supporting a massive effort in bringing food support to families, and more so in the now it's actually becoming more, and the need is actually growing every day more now than it was in the first few weeks, right? So Commonwealth Kitchen has been an incredible resource. And talking about contacts, there are people at Commonwealth Kitchen whom I've known for a few years now, but you see them in bigger meetings and you say hi, and all of a sudden, 5 of them from Commonwealth Kitchen got on the phone with me, and they said, these are the ways we can deliver food. Now we have Commonwealth Kitchen delivering food, and most of us at the school, at the health center, actually deliver food to the families themselves, so that we are safe, keeping the safe distance and everything. So that's going on. One key criteria we wanted to keep on our mind in terms of contacts was that we reached out to the behavioral health support staff, because we know that mental health and behavioral health issues they were big to begin with, even before this crisis. Now they're even more and deeper, and we know that many young people may not want to reach out for support. So we are using the help of our behavioral health psychologists and the clinicians from the health center to connect them with the students at Codman, and just having open sessions and saying, what do you need? Also, those students that were already on the group therapy or individual therapy, we are continuing to do so. We even also started right away a parent support group. So inviting parents and staff to join in through Zoom and just share their part of the burden and say what's going on with them. Another thing which I have loved is that, the Blue Hills Tennis Club, they have a wellness center. And we have recently formed a Dorchester Health Coalition over there with help of a few folks from Brigham and Women's Hospital. So we have been meeting continuously, regularly, to really say who is doing what. And so one of the big thing that came up was the providing support to families in terms of the eviction rule, because we had few families at Codman who were being threatened by the landlord to be evicted. And thankfully, as the information is floating around, that some of we were able to reach out to those families and say, this is the information, you cannot be evicted. So idea is that to sort of plug in the gaps and fill the holes, to make people feel that we may be inside our four walls, but we are still, the goodwill is still going around. There are tons of challenges and everybody's sharing a different burden. Of course, as you know, the communities of color, and I don't even want to just use the general term, but many of the communities, I should say, we are dedicated to working with, they are definitely sharing a bigger burden. On a fun note, what I did right from the very first week, what we did was saying, hey, spring is coming. How can we keep our kids feel a little bit more hopeful? So again, we reached out to our community partners, so Urban Farming Institute, which is right on Norfolk Street, Patricia Spence and her staff, and Oasis on Baloo, and Green City Growers. I got them all on Zoom, and we had a couple of long discussions. And what we did was we decided, hey, we need to supply sort of seeds and growing material to our students. Nothing is better than growing in springtime and knowing that many of these students don't have a backyard or a place to grow. So we provided them buckets, soil. It was awesome. And fourth grade teacher started to drop off seeds in the yard, in the driveway of these students. They'll come out and wave to her. And most of them are keeping track of all the things they're growing. Our science teacher for the 12th grade is doing that. So yeah, and it was amazing to see, because Urban Farming Institute, these are small organizations, they have suffered a lot. So for them to say, hey, we're not just asking for donations, we have grant funding support. So we are actually purchasing those items from them, seedlings, seed, soil. I'm a big believer that connecting to earth or connecting to nature in these times, in whatever way possible, could actually bring more hope to these young people, and also keep them connected to their roots. It's like a newer version of Victory Gardens. I'm an optimist by nature for everything, and as this pandemic has really brought out the weakness in our infrastructure, it has also brought out a lot of strength in people who actually are part of this infrastructure, right? And I think that's what I think of it, is that the system may be weakened, but the people who are running the system are totally dedicated. And that's why we are able to provide that support. So I am so grateful that so many community partners whom I have actually just known I'm much more deeper in connection with them, whether it's the Commonwealth Kitchen or Urban Farming Institute, or a lot of these communities, when people stand together in crisis, that is a different kind of bond. And I think it's not going to go anywhere, that feeling of being together, whether it's, even a wave of a teacher from the driveway to a student, that will be a much deeper bond now. Or the same way when you wave hello to somebody as you're dropping off food and saying, how are you? And you know that this is not a normal circumstances of how are you. So I know it will continue. And I also think that the ways we are working now, use of technology is actually going to make us more productive and efficient, and it will cut off some of the unnecessary sort of time commitments, but it will also make us more efficient. And I'm hoping that as we go back to whatever our new normal is, as everybody says, that we realize that the gaps that have been only highlighted, these gaps were always there, right? The disparities, the lack of access or lack of information, or even higher pollution in some of the communities that are being totally being impacted much more than other communities. How can we actually now reach out to more of those people? Whether, I think as community health centers, whether it's Codman Square Health Center or other community health centers, go back to resuming their function in the next few months, we can make that effort saying, hey, we have not heard from these people for so long, these patients, it is our chance to reach out to them more. I do think telehealth is going to be an incredible tool from here on. It has a lot of potential, which had not been explored. So this is our opportunity. So I do think that this crisis has highlighted weaknesses, but it also highlighted strengths we cannot ignore. We have to build on that, whether it's reaching out to parents who have not had a chance to get immunization, saying, hey, we missed out on your immunization, and we could have missed out on the immunization like a year ago before COVID started, right? But at least this opens that window of opportunity to say, we are going to reach out to more people. We are sharing this history together, right? And I just have been so impressed by how much effort has been put in, whether it's the screen time, but still everybody's making an effort, and that's what counts. Whether it's, I have had a local organization delivering masks to me nonstop. I have had face shield being made, 3D face shield being made by Brookline Teen Center, and I have had people delivering boxes of snacks and water bottles. So everywhere I have reached out, I have seen that those who were not they didn't even know how to get involved, they now know how to get involved.